And now something completely different.
Good afternoon. I'm speaking to you live just outside
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
That was odd. Hey guys, welcome to the show. We are live. Great to be back on this beautiful Friday here in Los Angeles, California. I want to say hi to my partner in crime, Joseph L. What's your middle initial?
I'm not telling you.
Okay, Joseph something Tillman.
It's a little too much for people to know.
Who is live in Vancouver, British Columbia. I am coming to you live from Beverly Hills, California. And, of course, this is the Hair Loss Show. Welcome, everybody. Now we're just doing the show on Fridays. And I have to tell you that not breaking up the week to do the live show makes, actually getting work done so much easier. Not saying this isn't work, that this isn't a vital part of what we do. Because it is.
But it don't pay the bills.
Because we're coming to you live and free with no laser cap links and, nothing underneath this, what are they called?
With no conflict of interest.
Right. With no, conflict of interest, which is wild that that's even written about. But, the reality is 2/3 of you guys by the age of 35 will be dealing with some sort of hair loss. 40% of hair loss sufferers are women. And, this is a silent epidemic of tremendous proportions. Joe, how's the sound, by the way? Is it coming in and out, or is it good?
Psych, it's pretty good.
Pretty good or good?
No, it's good.
Okay.
It's good.
Okay, that's my headset then. And, we're here. We've been doing this for a long time. I've been doing this broadcast for over 21 years now, which makes me old. I originally wrote my first book, started to do my research back in around, I'd say 1995, 96 is when I started to research the book. The book was published in March of 1998, and it completely exposed and changed this field forever. I'm not just saying that because I wrote the book, but the reality is everything else that was ever written about hair loss was self-promotional, was mostly completely bullshit, and really didn't expose the industry for what it was. I did concentrate a lot on the hair transplant side of things because that was what, at the time, seemed to be doing the most damage to people's lives. Mm-hmm. And the reality is, not much has changed, except back in 1998, we were able to kind of shift the gears in this field very quickly. It was a relatively small field. And when I came out on the radio and when the book was published, everyone was like, holy shit, we better get our shit together because this motherfucker, whoever the fuck he is exposing all of us. And within about a 2-year period, the entire field shifted from not using microscopes to not doing pure follicular unit transplants to actually incorporating and changing the infrastructure of their practices so that they could essentially compete. And it wasn't that difficult back then. Fast forward to 2019, we're talking about a completely different ball game. We're at a place now that is more dangerous than it has ever been because essentially think about what was happening in the 70s, 80s, and early 90s and mid-90s and scale that 200-fold. It's bad. And the bad work is getting worse. So, back in the day, we were really able to isolate what was happening, out there. And I created the Bald Truth recommended list in the book, which was, at the time, it had never been done before in any field of medicine. Basically saying, look, these are the only guys you should fucking consider. These guys didn't pay me to be in that book, as some people have claimed in the past, which is ridiculous. Like it was some sort of self-published book. But what it did was it set the stage for the good guys, at least, to have a voice for a short period of time. Then eventually that recommended list was bastardized and kind of like recycled on the internet. And, unfortunately, a lot of things changed very rapidly, I say, after the first year after my book was published.
Yeah.
The good news is, in 2000, I founded the International Alliance of Hair Restoration Surgeons, and we were able to kind of gather everybody back together in a really a more legitimate, a more societal fashion. That's why we, the way we put things together, that's why it is recognized as really the only hair transplant society, well, that is recognized by the mainstream media, that is recognized and endorsed by Consumer Reports, that is recognized by WebMD, that is recognized now by most of the major medical institutions, at least in the United States, as the go-to hair transplant society and resource. And the reason for that is we created a place where consumers can get information, do their due diligence, and it was a consumer-centric organization. Is it perfect? Absolutely not. But I can tell you what you guys are getting on Facebook and on Instagram and on YouTube is fucking dangerous. And this is what we're going to speak about more today and kind of delve into some of the realities that a lot of you guys just don't want to believe is happening. Take it away, Joe.
Or they may say, oh, well, that's off. That's being done in a place that I'd never go to begin with, like a country or region of the world where I have no interest in going to begin with, so I'm safe. You're not. If you're not doing your research, if you're not understanding what it is that you're getting yourself into, what the possible complications are that are occurring every day, then you are setting yourselves up for, to say failure is not even remotely close enough. You're setting yourself up for absolute 100% undeniable and perpetual misery.
A horrible fate that no one should ever have to deal with.
Yeah. So, before I get into what the actual topic is, I also want to throw in my 2 cents about the history of the industry, because I think it's important that people understand, and this goes back to the video I made, Celebrity Hairline Disasters, the Kyle Christie Effect, where I'm talking about, basically I'm just talking about hairlines. I didn't talk about harvesting. I didn't talk about, a lot of the other issues that people need to be aware of, because there's so much out there. Like, I could only concentrate on hairlines and how most hairlines today, and I'm talking about in the greater hair transplant field, most hairlines today are mini micrografting that's no different than what was being done 20, 25 years ago, before the advent of follicular unit transplantation, which by definition back in the day was strip surgery, but using microscopes to dissect, refine, and inspect the grafts to make sure that the singles were the singles, the doubles were the doubles, the triples were the triples, so on and so forth. You don't have that going on now with the majority of the clinics that are operating. And the reason being is most clinics haven't learned the real surgery that goes along with hair transplant surgery.
And let me just say this. One thing that people don't actually fully understand, because it's not discussed anymore in this field, is that hair follicles grow in natural groupings. And the key asset, the really important thing about follicular unit transplantation, about what Bobby Limmer discovered just by simply looking at someone's scalp under magnification, was that hairs grew in natural bundles, 1 to 4 hairs in general. And the key was to try to utilize those natural bundles and just move them without disrupting them.
Yeah, he had the eureka moment. It's like, why don't we just try to move them from the donor area to the recipient area as they grow naturally? Like, why haven't we been doing that? Well, it's because you couldn't see them.
Right.
Proper magnification wasn't being used. The microscopes weren't being used. And not to say that mini micrografting is in and of itself a bad procedure. Like, there's a lot of good work being done with mini micrografting that would actually stand on its own today compared to the average clinic. But the industry hasn't been pushing forward with regards to the artistry of trying to be as natural as possible. It's actually been going backward. That's what I was talking about when I say that it's mini micrografting from 20, 25 years ago, because a lot of the hairlines that we're seeing today and the majority of clinics that are FUE only are very pluggy. A lot of multi-hair grafts in the frontal hairline, right when, like the gate that you see when you look at the top of someone's forehead. Just plug rows. It looks horrible. Sometimes maybe not so horrible, but the standard of care in general has regressed to 1995. And what I didn't talk about was how the donor area has been completely turned upside down as far as how people approach it. And I remember you and I have spoken about this. I remember when FUE was first coming out, and well, not first coming out, but the first few years that it was out, as more strip clinics were picking it up, because independent clinics hadn't started yet, to where they hadn't had any experience with strip. They were just coming in, just starting FUE, from the beginning. There weren't any clinics like that yet. But the clinics that were starting up with FUE, they were, strip clinics or former strip clinics. And
they were actually hair transplant clinics. They had time on tissue for many years.
Yeah, and they were still thinking in the traditional sense of what the donor area is and where the donor area should be.
Right.
And so they're taking their the FUE extraction pattern in the traditional area that they would normally take a strip out, during a strip surgery,
which is known as the safe zone, the DHT resistance zone.
But they would take it in a very narrow band. And so when you're going into a very confined area to take out 2,000 grafts, guess what's going to happen? You're going to have a very confined area of scarring where there's no hair growing above or below, and it's just this massive gap of a wasteland. And I remember looking at that. It's like, yeah, they didn't think ahead.
Right.
And with that, I'd like to show what that kind of extraction looks like. I just happen to have some photographs.
Let me give you a full screen.
Do that. And here's a full screen.
Okay,
so
go in there. Let's see that. Holy shit. Did this guy take the pledge?
The doctor, I don't know if he took the pledge or not. But I'll tell you one thing. His patient sure is going to make some sort of pledge.
I took the pledge.
Here we go. And just so everyone can see. That is a very narrow area of extraction that should not have happened. So this is what some people would call a donor devastation story. And it makes sense. I mean, this guy, like, there's no options. Like, he could have a strip to cut a lot of this out, but if he doesn't have the laxity, then he's done.
Well, and here's the reality. The reality is that FUE is being sold as a scarless procedure. It is being sold as a procedure that would help you to avoid any type of obvious surgical intervention for your hair.
Yeah.
And what is happening today is, because it is getting in the hands of inexperienced novices, either buying machines and just doing these turnkey surgeries, getting very little training, or people who are going overseas and essentially going to hair transplant mills where it's completely technician driven, and these technicians are not trained in the preservation and the what it really takes to create an aesthetically pleasing donor area. You have a limited amount of grafts that can be removed via both forms of surgery, but when you're dealing with FUE, you have to be incredibly particular on how close you extract those grafts and how you actually utilize the grafts that are being extracted, because you are extremely, some people may not like to hear this, but you are much more limited. Your sweet spot, your 100% DHT resistant hair is not 100% usable if you just choose to go the FUE route. And that is something that no one really wants to talk about because they want to be able to sell less invasive surgery.
Yeah. And they want to make it seem like it's a trip to the spa.
Right.
Right. Unfortunately, I don't think this guy thought it would be a trip to the spa. Let's see. Where's this one?
I have to tell you, and that's actually the one that you just showed me. That's nothing compared to stuff that comes across my desk.
Oh no, I know. I mean, these are just images I gathered in the past. Like I used to have a file. I don't know what happened to my file.
And you got to see some of the shit that I see from some guys who are taking the pledge.
I'd love. You know what? I mean, I think. Well, I know of at least a couple, at least one that I'm about to show. I'm sure that for his, for one of the organizations that he wants to remain a member of, he did sign a pledge.
Right.
I'll be showing that here in just a bit. Let's see, I just gotta, hold on a second. So many. I wish I had this better organized.
Did you take the pledge? I'm sorry. I'm so sorry.
Not yet. But once I do, I'll be able to start surgery. Let's see.
Because apparently all you do is have to take the pledge, and you are going to be good at what you do. If you take this fucking pledge, you are going to, it's going to ensure that you have the patient's best interest in mind, and there's the aesthetics of the surgery.
Yeah, it ensures that you're going to have a great result, which I don't see how that correlates.
Just by signing a piece of paper, putting up your right hand, this is my right hand, and saying, I pledge to do well. I pledge to take care of patients. It's unbelievable to me, man. I gotta tell you.
If I was in a hoop contest with LeBron, I would love to be able to say, I pledge to do a great job against LeBron James.
Right.
And I would wish that just by making that pledge, that I would be able to dunk on him. That I would be able to hit 21 before LeBron.
We are in a situation, and guys, we're talking about some inside baseball, which many of you guys may end up seeing what's going on in the industry and through the main organization of this industry. But the reality is there's some sort of a bizarre concept that part of bringing awareness about what's happening in the field can also be leveraged as a marketing tool to market specific organizations and to market, specific practices, just because there are people willing to put their faces out there and say, I promise to do well. I promise to make sure that I'm doing the best for you. Well, this is called the practice of medicine. Even if these guys have good intentions, there's a wide variety of skill sets when it comes to the main organization of this field. And there are going to be many people who are going to take this pledge who sadly suck at what they do.
But
suck at what they do. We're never able to perform a decent hair transplant, in my view.
Aren't doctors supposed to take a pledge when they become doctors.
Yeah, it's called. Yeah,
do the best they can.
it's actually they've already taken the Hippocratic Oath. So why would they have to? And that's actually an excellent fucking point. That is an excellent point.
That's what I do.
That should have shut this thing down before it even started.
When it was mentioned, it didn't.
Jeez, I'm jacked. Sorry. I mean, really, should have just shut this thing down before it even started, because it is comical.
Well, back to the subject at hand. There are a lot of people that are saying, in order to get, to make sure that your donor is preserved, you shouldn't go overseas. You shouldn't go to, we'll say Turkey, because let's not fool ourselves. That's what any sort of mass, campaign is about. It's about Turkey, because Turkey has completely upended this industry. There are more clinics in Turkey than there are in all of Europe.
They are crushing it.
They're crushing it.
Europeans are just, they are running around like chickens with their heads cut off. They don't know what the fuck to do. They are fucking panicking. When frankly, there's so much, in my view, there's so much opportunity in this chaos. And I try to express this to these guys, and they are just so closed off and so out of touch when it comes to the reality of what can be accomplished, as far as you guys have the opportunity to really help people. But you're concerned about SEO on message forums, and you're concerned about this bullshit, and you're concerned about taking pledges. You're concerned about stuff that will not help or change the environment of this field, and in the end will not help patients. Go ahead, Joe. I'm sorry. I can't control myself.
Relax.
Okay. All right.
So what I was saying is, like, a lot of people are talking about how you need to be careful where you go, and a lot of these presentations are thinly disguised veils that are talking about Turkey, but not actually saying Turkey. And the problem with that is, a lot of the people that have a problem with the industry, they're not looking in their own backyard. And so, the point of this is that there is donor decimation going on in all the markets of hair restoration surgery. I present to you a case that is from North America, and that is about 2,000 grafts.
And this is from a guy who actually did take the pledge. He signed the pledge.
Yeah. Would you?
Sorry.
And but the bigger point is that this was in North America. Like, the issue with this is 2,000 grafts. From what I understand, the grafts were also taken from the sides, which is the way to do it. But the punch size was way too big.
That looks like a 1.2 millimeter punch.
It was about a
least.
1.25. It was about a 1.25.
Yeah.
And, it's performed by technicians.
What?
Yeah.
And this guy signed the pledge?
He made an oath when he got his medical degree that he will do no harm. And this guy, so what is he in a clinical setting for? To get SMP into the donor scars, the FUE scars, which is basically the only thing that he can do. If he were to grow this out, the donor region would be, it looked like a rabid moth attacked the guy. So he's done. One shot. That's all it took. And his donor is done. Like, he could probably get a strip out of that, but not a whole lot of hair would come. So, yeah. It's amazing to me, though.
Well,
one shot.
Well, and so this is the reality of the industry. Those who are out there discussing some sort of a black market have to understand that the entire field has become a black market. There are those who can be separated from the black market, but they have to be named. They have to be people who are willing to come on board and say, you know what? I'm not just taking a fucking pledge. Here is my work. We will be accepted by a third party and willing to separate ourselves from the rest of our colleagues to prove that we're out here trying to help you guys. When it comes to the IHRS, that has happened. Now, I'm going to be completely honest with you, and I always am. There isn't a physician on the IHRS that doesn't have an unhappy patient. And sometimes someone can be on the IHRS. They could, the infrastructure of their practices can change well into their acceptance. And there could be some problem patients, and then it has to, kind of revert back. Yeah. That is the nature of cosmetic surgery, and it's unfortunate. But, part of what we do, an important part of what we do, is to warn you guys that this is always a possibility, and you need to do your due diligence. Now, I was talking to someone who actually just had some exosomes injected into their scalp. And
who?
Exosomes. Exosomes?
Exo who?
Yeah, so the stem cell stuff. And
exosomes.
I told this person to ask the doctor who's doing this if this was a batch of exosomes, a shipment of exosomes that have been used in his practice prior to this person having injected into their scalps. Meaning, was it from the same lot? Was it from the same shipment? And did anyone have it injected into their scalps prior to this person having it injected? Not the same bottle, but the same batch.
Right.
And the person was like, well, what, why? I'm like, because anytime you are working with an independent lab and they are using and manipulating and refining and manufacturing any type of stem cells or exosomes or anything that is from a human body or from an animal body, like a bovine, pigs, there is a chance of contamination with several viruses and bacteria or bacterium, yep. E. coli being one of them. There have been some incidences, one in particular, where a company who was manufacturing stem cells, and they were, I think they were from umbilical cords, essentially shipped out this batch to dozens of clinics across the country. And people were getting very ill. Old people were dying, allegedly.
Really?
Yeah. And it came out that it was a bad batch. Now, there's a podcast by Wondery, I think it's a Bloomberg company, that is actually called Bad Batch.
Ooh.
And it discusses this particular case and focuses on the company and the issues at hand. And so, to me, this is a warning. A lot of people, and again, I'm bringing this up for a reason. A lot of people are, from the last program, they're contacting us about exosomes. They're contacting us about, what they should do. I know this person who just had it performed yesterday, the day before yesterday. And, my warning to everybody is ask questions. Know what's being injected into your body.
Yeah.
And I know I just went off on a tangent. I don't know how I got there.
I don't know where it came from,
but it's important.
I think because I was talking about how it's North America, and it's you're not flying off to Timbuktu for something.
Exactly.
Yeah, I think that's what
this
triggered.
The worst of this particular outbreak issue happened in Texas, and there were people who had gone to this clinic before who have had incredible results with different ailments. And there's a couple of stories, but one is of this elderly woman who had some issues, and her family saved up or took out a loan for $17,000 to have stem cell therapy and treatment to help this woman, and she almost died.
Wow.
So the moral of the story is, check out the manufacturer. Just don't trust the doctor. Check out their track records. Go online. And this goes even deeper. I mean, that's why we tell you guys to do your due diligence when it comes to, I know where I was going, when it comes to your surgery.
Yeah.
Yes, there are doctors who have been accepted into the International Alliance of Hair Restoration Surgeons because they have a consistent track record for a very long time, and they are performing consistently better work than the majority of the clinics that are out there today. But you still need to do your due diligence. You need to find out how somebody's surgery went 6 months ago.
Yep.
Before you make your decision. That was my point. I just spit on the mic.
That's a good point.
So,
and
you know what? And FSK in the chat room, I just want to let you know that your concerns and complaint was forwarded over to me. I will be able to do my best to speak to the clinic and to the doctor after the conference. So give me a little bit of time, and I'd be more than happy to take care of that as best as I can.
FSK, give us a thumbs up if you heard him tell you this. And we got a delay. Anyway.
Yeah.
And that's good. That's actually good news. So that is IAHRS taking care of business.
Well, we do our best. You know, there's nothing is perfect. And, you know, frankly, with this particular clinic, you know, we are not receiving, except for one other one, the amount of complaints that might be out there circulating on other message forums or whatever. And the reality is people have to come. Yeah, everything has to be validated. Our moderator actually knew after he contacted me that this was an actual patient. You know, this is validated without having to actually contact FSK. So
very cool.
That's the reality, you know. I mean, it's cosmetic surgery. Anything can happen. However, we want to make sure that at the very least, anyone who works with an IHRS member who may not be completely satisfied has a liaison and gets a little bit of hand-holding and some help to help them to resolve their situation, which doesn't exist in any other society.
That's right. Yeah, good point. Well said. So
that's what I do for a living, dude.
Where was I? I was talking about, so in your backyard, North America, FUE donor area decimation. It happens. Got another one for you. You might have seen this one before, Spencer.
Let me see.
What do you think of that one?
Yeah, that actually happened in, I'm not going to say name the clinic, but that happened up in North America, in Canada.
Toronto, Canada.
In Toronto, Canada. And that is an image that has been used and misused many times.
Oh, yeah.
Yeah. And if I remember correctly, that was one of the old school robotic procedures.
It was, and this is a perfect example of how it's the doctor, not the tool, that causes so much. Like, I remember, like, so many people were blaming the robot for this.
Yeah,
it's the robot's fault. Do any of you out there actually think the robot's going, let's do 5,000 today?
Yeah, and let's place them very close together and possibly overlap some.
The clinic and the doctor has complete control of the algorithm of the spacing of those graphs. How many graphs? How many graphs in a given area? All those parameters are at their fingertips. And so when you see cases like this, I'll throw it back up there, like this, and you have someone trying to tell you, oh, well, that was the robot, or, oh, well, that was a micromotor, or, oh, that was, insert type of tool here. It's all horseshit, because the only thing that matters is who is holding the tool or controlling the tool in this case. And it comes down to simple bad judgment, really bad judgment in this case.
And I will say that this was performed by a physician who has been in the field for quite a long time.
Yeah.
And may have taken the pledge.
It's just going to end, is it? Just
I'm sorry. I'm so sorry.
Well, I'm sure he has. I know. I actually know the doctor.
Yeah.
I don't work with him. Neither does Spencer. But I know the doctor.
So here's the reality, folks, and we'll give out the phone number. We'll take some calls. It's 888-659-3727. You're safe nowhere. You have to do your homework. The latest and greatest usually is not the latest and greatest. If it's a device, and if someone is selling you on a device, the tool is only as good, as Joe would say, as the hand that wields it. Period.
TM.
So whether someone's using a Harris Safe system, which I got to say that I don't really I kind of understand the concept of the dull punch, but when you think about it, anyway, I think there's a lot of really great systems out there that essentially anyone could use the Harris system and do a great job. Anyone can use Cole's system, CIT system, right? Is it CIT?
Yep.
PCIT. PCIT. Great system. You got, I would say smart graft with the smaller punches. If used by the right person, you're going to get great grafts. That's just the reality. And if you're using the smallest possible punches using the artist, and someone understands its limitations and is a real hair transplant surgeon, you're going to have no problems.
Yep.
I've seen some really great results. But, if you go to WebMD and you look up, a hair transplant surgeon and what to look for in a surgeon, and you'll read, the reality of what's going on. The great thing about WebMD now is they are actually publishing stuff that is not quite as generic as it used to be. And they are talking about the reality of hair transplant surgery and what's happening overseas, and really what to look for in a surgeon. And it's powerful, compelling content that I believe will help to kind of push this field in a better direction, or at least save a lot of people from being harmed. Anyway, phone number is 888-659-3727. But the moral of the story, people, is don't listen to the bullshit that's continuing to be pumped out there as to what's happening in this industry, why things are going bad. There are physicians out there who are losing their shirts to some really bad guys and to some good guys. And now they've decided to open their mouths and say something once they realize they opened up Pandora's box.
They decided to open their mouths and make noises.
Yeah, exactly. Now, after when the warning shot went out in 2008, when Alan Bauman and myself went out there and said, look, this is going to be bad. You guys have the opportunity to take control of this and to warn consumers. Let's make this happen now before it goes in this direction. They were terrified. Told me they were afraid of lawsuits.
Yeah.
Said, you know what, you just continue to do what you're doing, Spencer. We really appreciate it. Fast forward to 2 years ago, fucking sheer panic. Fast forward to today, a lot of these guys will not be practicing in this field. I give them 24 months. I know guys who are hobbling right now. Guys, I told you to hold on. I was going to take your calls. Now we got no calls. 888-659-3727. This is a live broadcast. So we will take your call as soon as we get a line lit. So call in. Phone number is 888-659-3727. If we don't receive any phone calls, since we had all the lines lit and they all dropped, sorry that we're telling you guys and trying to provide you guys with an education, for crying out loud. But if we don't receive a phone call in a few minutes, I'm just going to call it a day, because I've kind of been enjoying just working, not worrying about the show.
It is nice. You want? Okay. So I showed some local to North America disasters. So let's look at a couple of others. What you're not seeing with some of these is what the donor area looks like after it's grown out. So I'll go ahead and direct you to this one. I don't know what the graft count was, but back of a guy's scalp,
Hold on.
and the hair's grown out.
Hold on. Where's that?
What's that?
Where was this guy? Where did this guy go?
I actually don't know this one.
Is it did you say it was in North America?
I did not.
Oh, okay.
I said I don't know where he went, but that's the back. It's grown out. You can see the hair down at the nape.
Yeah. Terrific.
Yeah.
You know what I found interesting is that, you know, these device makers who essentially used to show scars, strip scars, and made the strip look like it was some sort of butchery.
Yeah.
What's happening today, like back in the day, things for the most part, if they found a good doctor to correct them, I put the camera on me, Spence, it was correctable. This is irreconcilable. Say that for me.
Irreconcilable.
Yeah. You can't correct it. For the rest of this guy's life, he will, unless he has a tattoo on the back of his head, which will eventually fade or turn blue, unless he has, you know, Elaine Lardy's technique. Guy's fucked. That's it. Game over. Out. No scar revision for that guy. Half of his scalp is now scar tissue, or at least a good third.
Now I want to show something that's interesting.
We do have all lines lit, so I don't want these guys to hang up. But I would like to see what you. Go ahead, show it.
I do it now. Okay, all right. So, you know, there's some fear about unlicensed clinics or doctors doing the procedures, and this is one of the cases that's presented. I don't know if you've seen this one yet, Spencer.
I have.
Okay, so the one where the hair is buzzed, and then the one on the side where the scalp is still bald.
Right.
You want to know what this tells me? While it's obvious that, you know, these are extreme reactions to the procedure, it's not telling me that this is a permanent issue. Because the guy on the I guess this guy here,
shock loss,
right there. Yeah, this looks like really bad shock loss to me, which I've seen with strip.
Yeah,
I've actually seen a strip is so bad to cause this kind of shock loss on this guy.
Sure.
Guess what? It grew back.
Yeah.
Both of these guys are very early because the guy in the back, his hair is still shaved in the manner that the clinic would shave it for the procedure, and the other guy that's still bald, well, nothing's growing on top, so it's still early for him as well. Major shock loss from any procedure can last several months, so we don't know if this is legit or not. It's bad, but we don't know if it's legit for the long term. But with that said, let's look at a couple other ones. Here's one that is legit for the long term. 5,500 grafts. And that's...
God help this poor guy.
Actually, take that back. That's 2 months. Sorry, wrong one. Let me get that focused.
Yeah, but still, I have a feeling that's going to be permanent.
But it's still, that's like, you can see the redness in the donor area. There's a lot of activity going on. Blood vessels trying to reconnect. And,
sure.
And yeah, that's still bad. But there's one I wanted to show here. Oh, yeah. Here it is. This one is almost a year.
Yeah. Now, did this guy go overseas?
Yeah.
Okay.
Yeah. So there's a mix.
So here's the moral of the story, guys. You know, the concept of getting a cheap hair transplant, listen, you do get what you pay for when it comes to hair transplant surgery, but you can get the same thing if you pay top dollar. That's the reality. So,
well, hang on. Let me interject there. The idea of, you know, associating a cheap hair transplant with a bad result, I think does a lot of clinics a disservice that are actually cheap but are doing really good work.
I agree with you, especially those who are out of the country.
Yeah.
People who are performing surgery in India. People who are performing surgery, good surgeons performing surgery in Turkey. So absolutely, it does them a tremendous disservice. You're right about that.
And I think that any sort of concerted effort to single out cheap as being an indicator of the quality, I think is doing any members of an organization that do offer cheap hair restoration but great work an extreme disservice.
I agree with that. That's especially on an international level. I agree with that. Here in North America, there are certain costs to being able to perform state-of-the-art hair transplant surgery. Yeah. So they can so that the cost could only be so low. Is it possible to have a hair transplant for $3 a graft that is state-of-the-art? Sure. I mean, he's going to be working on very small margins and willing not to make a lot of money. So it's possible, for sure. But that's really going to be hard to find here in the U.S. Would you agree, Joe?
Absolutely. Yes, I would agree. It would be very difficult to find that in the U.S. or in North America.
In North
for
America,
sure.
right. All right, so let's take some phone calls.
All right.
Hey, man, you're on the air. Thanks for holding. What's your name? Where are you calling from?
Hey, this is James from Texas.
James from Texas. What's happening, man? How are you?
Good. How are you? It's been months since I've called.
I know.
Welcome. I'm going to put you on. I'm going to try to do Instagram live right now. Let's see if we can make this happen. Go ahead. Where's the line?
Yeah. So, like I said, it's been a month since I called, but I just wanted to give you a little bit of an update because last week I went to a doctor just to get a consultation. We talked about FUEs and stuff like that. Because prior to that, I'd been and they prescribed me finasteride, so I've been on finasteride for a year now. Even though initially I was scared of it, but I built up the courage and I started taking it. So it's been a year. Okay. Went back. According to them, my hair has improved. They took pictures and everything, and they showed me. I was hoping that they would have like a more quantitative way of measuring that rather than just visual. I know that there's like machines out there, like you take a picture of your follicles and it can kind of actually count the number of like follicles, I guess you can say.
Yeah, but let me interrupt you for just a second. Just so you know, like there are measurement tools are called densometers, but when you go back after such a long time, a lot of that's not going to be accurate because your hair is constantly in a state of flux. Like you've constantly got, the percentages are depends on who you talk to, anywhere from 10 to 20% of all of the hair on your scalp is going to be in telogen. Like you won't, it's gone. You don't see it. Whereas the rest will be, an anagen, and it's not consistent on where that is. So, sometimes one area that they're checking may have more hairs in telogen than a year from now. You may chalk it up to the medication, or vice versa, and they might even be saying, "Oh, it's hard to tell because the numbers don't correlate," or you might actually have less hair even though you feel like you've got more hair or your hair is thicker, right? So, they do have their place, but I don't put a lot of stock in that. In many cases, I think it's. In many cases, I think it's just to kind of impress you.
Okay. Well, speaking of phases, now that you mentioned that, this wasn't part of my question, but you brought up a good point because I'm curious because I think after I started minoxidil last year, and just to give a description of what my hair is like, I have diffuse thinning. I've had it for years, but I never really noticed. I actually have an old picture right now I was looking at earlier from 2016, but had no idea up until 2018. Because diffuse thinning is kind of hard to notice rather than the other conventional, like receding hairline and, where just... But, so anywho, I had the Norwood 7 pattern even back then. But when I started minoxidil last year, it got really severe, the Norwood 7. Like... And it must have been the shedding phase, or it must have started switching or synchronizing everything to the antigen phase is what I'm thinking, because there was a point in time where you couldn't see that. Like, it was very, very heavy, the Norwood 7 pattern on the back, and I thought for sure I was going to go bald within like a month or two. I guess that's your the dread shed is what they term it. I guess I was going through that, and then when it came back though, it was like you couldn't see the pattern at all, and I thought, oh wow, I thought this is I cured my hair loss. Little did I know, but I thought, okay, minoxidil is all I needed. But then I guess the pattern started to come back, and I still have, like, it's right now, it's not as apparent, and it's improving. But I guess my question to you, or for either of you, is because I have diffuse thinning, I'm on minoxidil, finasteride, and I've been on 0.5 milligrams of dutasteride since March. I know it's a very, very strong drug, but I don't know if maybe my situation is a little different than most, because if it's said that DHT promotes body hair on your body, well, I have like thick hair on my chest and my stomach and my back. I grew hair on my back. Ever since I was little, I grew hair like at the very my lower back. And well, every now and then I have to trim it in the back of my arms. And so I'm wondering if maybe my DHT levels are different than most because of that, because it said that that's a sign, the body hair is a sign. So that's why I jumped onto dutasteride. So right now I'm just kind of hoping that maybe my hair continues to improve. It doesn't appear to be getting any worse, but recently I bought a microscope. Honestly, I should have bought one like last year, but I don't know why. I never really thought about it. And then I used it.
You bought a microscope, or you bought like a densitometer to connect to your phone?
Yeah, you can connect it to your phone, but it's like a universal microscope that you can use. It's like it has like a little light. It's like a pen almost, but you can use it. It's what you can see the follicles with it, and so I'm able to like zoom in and record video and take pictures. It's great. It's awesome.
You're a fucking hardcore, man.
Yeah, honestly, whenever I bought it and used it, I was on it. I was using it for like an hour. I just kept looking around, looking at my entire scalp.
Yeah,
it's amazing. It's amazing when you can see, because I mean, it's one thing to look at the mirror, and everybody does it. Everybody looks at the mirror and see, okay, what's my hair look like today? Is it improving? Is it getting worse? But when you have a microscope and you can actually see the follicles and the miniaturization, it's just another.
You could do like a skin cancer check on yourself, man.
Yeah, but it was fascinating to me, to see that. And I saw the miniaturized hairs, and then I saw the thin wispy hairs. There was like 3 different types of hairs. I saw like the really thick, I guess the terminal hairs, and then I saw the thin wispy hairs, and then I saw which was, I don't understand, is like I have like it looks like a terminal hair, but it's just shorter than the others, and I don't know why. It's like I cut my hair the same size, but for some reason in between, like there's some terminal, or appears to be terminal hairs, they're just like shorter compared to the others.
That's the way hair is, man. I mean, hair isn't growing. It's not. If it was synchronized, you would lose all your hair at one point, and then you would have to wait for it to grow in.
Yeah, now that makes sense. I didn't really think about that, but see, I was kind of hoping that it was hair coming back. I guess I was just being hopeful.
Well, it might be hair coming back, or maybe hair that is miniaturized that you're still waiting for possible reversal.
Mm-hmm. So what is I saw some thin hairs, and then I also saw some it almost looked like white hairs, but they were very, very thin.
Well, the white hair is vellus hair. So essentially, your scalp at any given time is going to have could have a significant amount of vellus hair, just like your arms or just like any other part of your body, and that's unpigmented, unmatured hair. Will that ever mature? I have no idea. I don't know where I don't have a crystal ball. But where are you right now? And then we're going to take another call in a second. But at this stage, at this moment, today, how do you think you're doing?
Well, if I were to keep the hair that I have now, I guess if it was to be stabilized as is, I would feel comfortable. But I would like a little bit of improvement on the temples because it's slightly receded. But if it's the density that it is now, I mean it's diffuse, but so the untrained eye, you can't tell that I'm suffering from pattern baldness.
Well, then at this point you win, man. And you know the reality is, don't have hair greed. Listen, I wish a lot of things, but I'm also grateful for a lot of things. The fact that you are in a position where you've been able to save your hair so far is huge. You know, just 25 years ago, this was not possible. That seems like ancient history. But when I started to deal with hair loss, finasteride or Propecia was not approved by the FDA. Minoxidil was not yet, or Rogaine was not yet approved by the FDA. I had to have a physician prescribe Lonartin tablets, which was oral minoxidil, at a compounding pharmacy, and slap this crusty shit on my head every night. And I did that for like 2 years until Rogaine was approved by the FDA. You young guys have it. You guys are so fucking lucky you have no idea. And that's what actually, when I think about the guys who are trying to avoid the FDA-approved products and replace it with all this gray market shit out there because they're afraid of adverse side effects, they are really, what's going on? It's like a fire drill. They are really not, or sadly, they are missing a tremendous opportunity that, God, guys in my point in life, 25, 30 years ago who were dealing with hair loss, I mean, it would have been incredible. I'm at a point now where I'm lucky enough to save a lot of hair because I started it, with enough time. But if I had the opportunity to start right away, I would never have to deal with what I've had to deal with all these years. So your phone is cracking up, man. So
mine.
Yeah.
Mine.
But listen,
okay.
I'm glad that you're doing well. I hope we answered your questions. Keep us updated on what's happening. All right.
Well, if you mind, do you mind just asking me or answering one more, if that's okay?
Go ahead.
Just a quick. Okay, because I'm not quite interested in the transplant yet. I just went for a consultation just to see what they have to say. But the doctor said that I have too much hair, that there's nowhere to place it, and which makes sense, because it's diffuse thinning. But when I use the microscope, she's right. There's like so many follicles everywhere.
I'm going to stop you. I'm going to stop you right now, dude.
I was about to.
You just told me that you would be satisfied to keep what you have. You also say you're a diffuse thinner, meaning that your donor area, if you are a true diffuse thinner, may not be appropriate. Or even you may not even be a candidate for hair transplant surgery if, in fact, you are an actual diffuse thinner. And it's not just typical male pattern baldness, and some guys do have a diffuse pattern, and they are able to maintain a strong donor wreath. But the point is, you're not even close to being, a candidate for surgery, and you should just stay away from that. Don't go to see these guys.
What you said that stood out to me was, to people around you, you don't look like you're losing your hair. So stop worrying about surgery, dude. Like, put it on the shelf and walk away. It is a non-option for you right now.
There's no way I was going to get surgery, especially because, like I said, because I have follicles there, and it would just be transplanting hair on top of follicles that are already there when it has the possibility of possibly converting them back to terminal hair.
Here's the reality: is that you will be able to find a doctor who will transplant you. I went to, and he's dead now, but it's just the reality. I don't like to speak ill of the dead. I don't know why. That's a ridiculous thing if they were not great people, in my view. But I went to Dr. Norman Orenreich when I was 22 years old, with more hair than I have right now. And he was willing to transplant me. He said to me, if you were my own son, I would say, try a few transplants. His exact words, like, try a few. What the fuck does that mean? They would have been 4-millimeter plugs transplanted below my natural hairline. And he said, this way you can keep up with your hair loss. And I was able to step back and say, there's something fucked up about this. But you know who wasn't able to step back? Poor Joe from Staten Island, who you may not know because he doesn't call the show anymore, or countless other guys who were the original walking wounded. Joe Tillman.
Thank you.
Yeah.
That was like that's what happened to me. Like I should not have had surgery. I was a little bit receded. I was like a 2A maybe. And I've told this story before. It wasn't until my second surgery that I asked my first intelligent question. What happens if I lose more hair? You want to know what this son of a bitch said to me? Dr. Richard Norris or Edwin Norris, Knoxville, Tennessee. He said, "Oh, you won't need any more. You're not going to lose any more hair. Not till you're at least 50, and then you can come back and see me. But I won't be around anymore." Want to know how long it took for me to lose more hair? 6 months.
Oh wow!
I was a Norwood 4 by the time I was 25, and the only hairline I had looked like the upside down of a bristle brush.
So this guy was a full-blown Norwood. There was no medication that he was able to take. Well, actually, no. I think you were already at a point where Propecia was approved, right?
No, it was 95.
Oh, okay.
It was 95 for me, and it didn't get approved till 96. So
it was approved December of 97, I think.
Or that. Yeah.
So the bottom line is no, he didn't have a choice of medication, but the doctor could have said, listen, you know what, you have a little bit of thing, why don't you try minoxidil? You're not a candidate for surgery yet.
Yeah. See, I'm at the stage where I want to say there's a possibility of recovering because I see the follicles and I'm hopeful for that. It's almost like it gives me hope because I see the follicles and it's almost like, I guess the way I'd liken it to is like, it's like you're trying to do CPR and revive these last few follicles that are, well, not last few, but you're trying to revive them.
Dude, I'm fucking 54 years old. That's the story of my life with everything.
Yeah. So I'm curious, like on a bald person's head with a microscope, are you able to see follicles or what do you see on a microscope?
100%.
See very fine vellus hairs.
Okay, and does that mean they're like dormant or they're dead or if you can see them, they're not dead, right?
They're dormant. Essentially, what a vellus hair is, when it's a scalp hair, it is no longer programmed to grow to a terminal length that's aesthetically acceptable. But the follicle is still pumping out enough volume or enough hair, enough keratin, where it will grow an unpigmented, almost invisible type of hair, very short. Listen, dude, we're going to take some more calls. I'm glad you're doing well. You know what you should try to do?
Yeah.
Stop listening to the show. Stay off the fucking forums. Enjoy the hair that you have. Keep taking your medication, and throw that microscope away, or hide it somewhere for a while.
Yeah. No. Well, I've done everything else. I'm not on the forums anymore. I do listen occasionally, but I'm not like stuck to the phone or computer. And obviously, I don't call as often anymore. So I've have a little bit of peace, but I mean, it's.
Well, I know sometimes the show itself.
Sometimes
the show itself gives people some solace. So I mean, you could listen to the show. I mean, but I would say the bottom line is try to stay away from this whole hair loss world as much as you can while you are still in the position that you're in. Do your best not to think about it. And if you just want to listen to two old guys talking about hair loss and other people's stories to make you maybe feel better about yourself, because there's a lot of people who are really fucked up out there, this is a good place to come.
Hey, I think that no matter what, whether I maintain my hair or I lose my hair, I mean, I'm going to be a part of the community, and we're brothers. I mean, regardless of whether if this medicine is a solution for me or not,
we are part of a very fucked up fraternity, my man.
Yeah,
absolutely.
All right, listen, James. Thanks for the call. Good luck.
Yeah, of course. Thank you.
See ya.
Bye.
Phone number is 888-659-3727. We are live here. I am live from Los Angeles. Joe Tillman is live in Vancouver, British Columbia. And we're here to take your calls to discuss everything and anything about hair loss. I should have said anything and everything, I think. Hey, you're on the air. Who's this and where are you calling from?
Dan, can you hear me?
Yeah, absolutely, Dan. How are you? Where are you calling from?
I'm calling from Milwaukee, Wisconsin. I called in, I don't know, maybe a month or 2 months ago. I told you about Dr. Panine. Do you remember Dr. Panine?
Yeah, I remember that. Yep.
Yeah, he did a transplant for me.
Mm-hmm.
and it was excruciating, at least. I mean, it was. He cut so much out of the back of my head that I remember him trying to close it back up, and it was just. I mean, it was just the most unbelievable pain that I've ever felt in my life. He had to give me shots. I think through the whole procedure, he gave me like maybe 10 shots for numbing.
That's all?
Well, I don't know if that's normal, but it took a lot. And he had to when he pulled it together, you could feel my scalp rip because he wasn't able to do it. He wasn't able to get it right.
Now, I remember your call, and I remember the last time you called in, and I guess the bottom line is you said that you were, as far as the aesthetics of the transplant itself, this was your second transplant. You went to somebody initially who you were not happy with the growth, and then you went to Dr. Panine for repair work. Am I correct?
Yes.
All right, and according to if I remember the phone call, the last phone call, you said that the results were terrific. The growth.
Yeah.
Yes. The result. The front was perfect. I mean, I had no complaints there. But the problem with it is that when I had a major shock loss, and I'm talking, it was about maybe 2 inches by 3 inches, which was a complete bald spot. And he told me, this is normal. It should come back. And some of it did come back, but a lot of it didn't. I mean, it's just a big. I mean, you can feel when you touch the back of my scalp that it's like a chunk of skin was missing. And I still have this major, like bald spot in the back of my hair where the scalp, in the middle of the scar, the linear scar. So, he offered to fix it. He's like, come back, we'll do a FUE on it. So I came back and FUE on it, and none of it grew back. None of the FUEs grew back.
Joe, why don't you ask this guy a couple of questions, because I think that we got a little insight about this particular case, if I remember.
Let me ask you, caller. Your first procedure before Dr. Panine. I'm not asking where it was. I don't care. But how was the donor scar from that procedure?
It was excellent. I was very happy with it.
Okay, so you had the procedure with Dr. Panine, and you went to a different clinic before that. I remember talking to you about this, where I was explaining to you that even if a donor scar looks normal, like a good normal donor scar should, that underneath that tissue there can be excessive scarring that can fool the best doctor out there as far as what your laxity really is and how much tissue can be taken out. Do you recall that?
Yeah, kind of.
Yeah. So that's the issue. Like, this is the issue with strip surgery in general. With FUE surgery, it's a blind technique. You can't see the hair underneath the tissue, and it takes a lot of experience to get a grip, pardon the pun, on what's going on with that. But when it comes to strip surgery, the blind part is what's happening with the scalp underneath. Like, you can pull on the scalp as much as you want, but sometimes the connective tissue, the scar tissue, can be so wide underneath that skin that you not only can't see it, but you can't feel it properly until you actually open up the wound. And what happens is the scalp remembers, and once it opens up, it actually opens up like a shutter, or not a shutter, but like the pull down blinds. They're on spring mechanisms. Sometimes that's the way a donor area can open up if there's been a previous surgery, because the scar tissue is actually holding it together. And so once you cut down into that tissue to open it up, it opens up like a pull down shutter or blind, and it's a complete surprise. And even the best surgeons on the planet can't identify this until it's too late. So I understand what's happening. And so when you have the shock loss, that was simply from the pressure of having to pull that together and having to keep it under constant pressure so it would heal. And It's a well, not common, but it's an issue that can and does happen with strip surgery, especially if you've had multiple surgeries. So then the problem becomes you had FUE into it. How long ago was that?
Few years ago.
2 years
maybe
ago.
2 or 3 years ago. No, about 3 years ago.
And have you been back to Dr. Panine to talk about this?
No, I just after the second one, after doing the second one and then doing an FUE, I just gave up. I mean,
How many grafts did you have put in the scar?
He said about 1,200.
Okay. And you're okay, and you're saying that it's bald in this area, or is it just thin?
It's bald.
Like no hair at all?
None. When I put my finger on it, I can feel all bare skin.
Are you able to, when you style your hair or comb your hair, is it visible?
If I don't keep my hair a certain length, it's visible. Like because I like my hair short, and I can't keep it short in the back because of that. I have to grow it long in the back because if I don't, it's completely visible. And I really want to fix this, but I don't know how to go about getting it fixed.
It's possible. It's possible that it can't be fixed. It's possible that you know it's been. You're at the point where maybe you need some sort of camouflage, or if you're comfortable with your current hairstyle, and it's not really affecting your life, then you may have to wear your hair slightly longer.
Yeah, that's basically how it's working now. One of my questions that I have for you is. I keep wanting to, Propecia is something that I really want to use, but I'm afraid to use it, because, I hear that, the horror stories with Propecia. And I kind of want your opinions on what you guys think I should do with that. I mean, if it's more safer than they're kind of making it out to be.
All I can say is that I've been on the drug for over 25 years, so that my experience has been great. I've had no adverse side effects that I'm aware of, and I don't know. I could end up with some sort of rare form of cancer. Will it be related to the drug? I have no idea. I've been on it for a very long time, but as far as the side effects people are concerned about. The reality is it really does happen in a very small percentage of guys who use it. Now, I'll give you an example of what's happening in today's world, in today's market. There are companies now that they call themselves hair wellness or lifestyle companies that are selling generic versions of finasteride through television.
Like Hims?
Exactly. And if you actually look at complaints on forums, and and out there on the internet, the companies that are selling these products are getting very limited concerns or complaints, especially of the long-term adverse side effects. And the reason for that is, what's interesting is because the P word was taken out of it, and because of the way that it's being marketed as something for wellness, that the psychological ramifications, the psychological factors, the placebo effect doesn't seem to be as prevalent amongst those who are using or ordering these products through these services. I find that fucking fascinating. Don't you, Joe?
Do you find that the generic version is just good enough? I mean, it's good enough.
I'm a brand whore, and there are plenty of generics that really work well across the board. But there's a book that everyone should read if they're considering using generic drugs. And I'm trying to think of the name of the book, Joe. Do you know what I'm talking about? I talked about it before.
Can I ask you how?
No.
Sorry,
go ahead.
It is, what is it? I have to look for it. But essentially, it discusses the reality of generic drugs and, where they're being manufactured and all of the loopholes and the issues with once certain drugs were tested. We're talking about life-saving drugs, and they did not seem to be as effective as the brand names. We find that with finasteride as well. It depends on where the generic is coming from. The only issue when you're ordering these from these wellness companies is currently you don't really know how long you're going to be on a certain generic. So a company could get the generic from one manufacturer for a few months, and this is the generic that you're using, and then they may strike up a better deal someplace else, or the company may no longer be manufacturing finasteride for whatever reason, and they have to switch to another generic. And as you continue to take this medication, you never know when you're being switched and to what you're being switched to.
Can I ask you, what does the name brand Propecia go for a month?
Oh, it's highly variable on your market. Like it's yeah. I mean, go to your pharmacy and ask them because that's. I mean, we could tell you $100 a month, and it could be $60 a month.
Yeah, I use brand name Proscar, and I take one tablet once a week, which is very unusual. I do intermittent therapy, but listen, I have no problem with generics. I have no problem. I actually think, and it's a double-edged sword in my view, companies like Hims and Keeps, I think they have really changed the game for younger, especially for millennials. I know that you're not a millennial, but guys who are so terrified to use this drug now are younger guys are starting to stop their hair loss and have the ability to not use gray market products or avoid surgery. Where just 5 years ago, people were so frightened to use this because of all of the fear-mongering online. And I'm not saying that some of these side effects don't happen to some people. They do. But there has been a mass hysteria effect. If I told women that they have a very strong chance of having significant adverse side effects from birth control, whether it's hair loss or even adverse sexual side effects. And if that was out there in the mainstream, and there were a couple of women who were really pounding their chest, really beating their drums about this and going online and starting message forums, it's very possible a lot of people would be terrified to use birth control. And to be honest with you, if you really weigh the two medications, oral contraception, the birth control pill, the pill, has significantly more side effects and more dangerous side effects than finasteride, and including the side effect that every guy's worried about, continued sexual dysfunction after discontinuing the drug. And that is something a lot of women suffer from.
I'm more concerned about the cancer aspect, not the sexual side effects.
What cancer aspect?
What cancer aspect?
That's an ancient study that has been refuted.
Oh, I have. That's been the only thing that, because I mean, just like I was talking to some guy and he said, yeah, that Propecia can what is it? Prostate cancer.
No, the study wasn't that it caused prostate cancer. Those who were found to have prostate cancer seemed to have a more aggressive form, or a form that at a later stage. That could be for several reasons. One is maybe finasteride altered people's PSAs, and they were never, the cancer wasn't found early enough. But after secondary studies, and I think there were two more studies done, they found that, in fact, at least now they're claiming that finasteride actually may help to be used as a prophylactically to prevent prostate cancer.
So basically, I should just take the chance and use it.
I can't tell you to do that.
Basically, you should do what you feel safest doing, but based on what you just said, your only fear was, and then it was found out in subsequent studies that fear has been refuted. There you go. Do what you will.
So both of you take finasteride or Propecia?
Yes.
Yes.
And you're both happy with it?
I'm miserable. I wish I never took that fucking pill. Dude, it changed my life. The reason I'm behind this mic, the reason I was published at a young age, the reason I started the entire Bald Truth, everything that we do, is because of this drug. It changed my life. It gave me hope. It made me realize that everyone who was trying to sell me bullshit during my initial throes of hair loss, that were trying to get me into wigs and they were trying to do transplants on me when there was nowhere to place grafts. I was able to step back, take this medication, slow the progression of my hair loss, and realize, this whole industry is fucked up. I'm going to write about it. it gave me a new purpose in life. Let's put it that way.
Yeah, and I watch you guys all the time. I love your shows big time. I don't miss one. I watch them all the time.
Thank you.
And it's very helpful. Makes you feel a little bit more, good that, people are out there actually trying, pushing out the truth. But I'm going to do it. I'm going to go for it just because of the fact that what do I got to lose,
Well, just talk to your doctor about it, go over your concerns, and then you guys can make a decision together.
Yep.
All right.
Good advice.
I'll definitely do that.
All right, man.
I'll definitely do that.
Good luck with everything.
Hey, thanks, man. I appreciate it. Hey, one other thing. You said about things that I can do to hide it for the bald spot. You said something about I don't know what was the word you used, but
there are
like
there are concealers out there. There's
camouflage.
Essentially, there's one called Dermatch. There are sprays. There are kind of like women's. It's kind of like it comes in a compact, and you can camouflage depending on the area. I mean, you could really, especially when it's something like you're talking about, and you have some hair growing over it. It could. Really,
what about the tattooing of it? They got that tattooing thing.
Yeah, dude. Listen, you can do. You can do temporary SMP. You can do. That will fade in time. I'm not a fan of permanent SMP for many reasons. One, eventually you're probably going to go gray. So then you're going to have a dark spot on the back of your head, and that may turn green. I mean, it's a fucking tattoo on your head. Dude.
Yeah, I agree. That's not a good idea. That's not a good idea. I'm already going gray, so yeah, that's not a good idea. All right, well, thank you guys. I much appreciate it.
All right, man. Listen, good luck.
All right. Bye-bye.
All right, thank you. Bye.
Phone number 888-659-3727. We are live. I'm here in Los Angeles. Joe Tillman is live from TBT Studios in Vancouver, British Columbia, and we are here to take your calls and answer your questions about anything and everything hair loss, as fucked up as that sounds. That's my job. Hey, you're on the air. Who's this? Where are you calling from?
Hey, hello. Can you hear me well?
Yes, man.
Hey. What's up? It's Antonio from D.C.
Antonio Fuentes.
Antonio, what's happening, man?
What's that? All right, yeah.
What's up, buddy?
How you guys doing?
Can't complain.
How's your day been?
We're working, man. We're working. What's going on?
I don't know. I just want to catch up. It's been a while since I watched the show. Basically, you guys are really inspirational, especially with your conversation with the last guy. But I'm here to talk about. First of all, can you guys give some people in the chat some hope? So there's this guy asking about how to cover up FUE scars that been over-harvested.
Sadly, there are a few options. One option is what this guy was talking about. It's SMP into the area, and it's a commitment. Joe?
The other option is potentially beard hair into the scarring area. If there's enough, if there's a viable donor source somewhere, that is an option combined with SMP in the right situation. I mean, it's a highly variable issue. I mean, there's so many factors that go into determining whether it's a good idea or not. I mean, in some cases, just shaving the entire donor area or shaving the head, because there's really nothing else you can do. I mean, it's a really deep subject. I mean, you can't just say, well, you got to do this and that'll fix it, because it's too general. I wish we could be more specific, but overall the options are very limited.
So basically, if you have,
sorry, let me continue. That is the whole point of today's show. Like, the title was FUE. I forgot what the title was, but donor areas destroyed in one surgery with FUE. When I say destroyed, I mean completely fucked. Like, there's nothing you can do. Like some of the cases I showed, there's nothing, like, they're done. Like, they will permanently look like they're a burn victim.
And I will say this: that was an extreme case that you showed, but I'm not making use of hyperbole here. At least here in North America, I would say a minimum of 40% of all FUE that's being performed will cause permanent, in my view, disfigurement. That's the reality of what's happening in today's market. Worldwide, maybe 60%.
Okay. But even if you have like a fucked up case, can that person still like shave their head completely? And like, how do the scars look? Will it be like race scars? It depends, I guess, on their ethnicity.
It depends on the person. It depends on their skin color. It depends on, if it happens to be someone who's extremely pale, and the scar tissue happens to blend in with their natural coloring, it's possible it could look, if they're lucky, it's possible it could look relatively normal. It's unlikely. It's at the very least going to look, every punctate wound could possibly look different. So part of it could be raised. It could kind of look like fucking Braille on the back of the guy's head.
Yeah.
Okay. All right, guys. So my last question. Everything's going pretty good right now. I'm happy. I'm about to start working. I just got a bachelor's in accounting. So I'm finally gonna be. Thank you. I'm going to finally earn some income, and I'm actually trying to decide whether to go with Dr. Cooley or the last video Joe posted with this Indian company. They seem pretty good at what they do.
Oh yeah,
they both are.
They're both fantastic. I mean, I actually talked to Dr. Cooley today, and just catching up on some things that he's doing. It's always great to talk to him. And I was talking to Dr. Sethi just a few days ago, talking about some future projects that we're going to be working on. I'll say this: I'm really glad to bring them on board. I mean, they were accepted members of the IAHRS early this year, and I told the story on the video about how I got kind of hooked up with them, and I've been nothing but impressed. Like, even behind the scenes, like just talking to the guy. The guy is Dr. Sethi and his wife, Dr. Bansal. They're really good at what they do, but Dr. Sethi in particular, like, he's obsessed with trying to always improve himself.
I can tell you this: I had them both in the studio last year when they were here in Los Angeles, and both of these people, husband and wife, are obsessed with doing this correctly. I have never spoken to two people who they didn't want to talk about anything. She actually told me she's not interested in socializing. I thought that was a funny line. All she wanted to do was talk about hair transplant surgery and her thoughts on surgery and what needs to be done in the industry. And it was just, I'm like, listen, have a drink, relax. We're in the studio here. Let's have a little downtime.
Yeah.
For them, there is no downtime.
No, I've never seen people work so hard and who are so. There are plenty of doctors who are as passionate, but it's all hair, all the time.
Yeah.
Okay. So they're both. What would you guys say is the most cost efficient way to go?
Not even going to touch that. That's completely up to you.
Yeah, you got to make that choice, man. You're an accountant. You can figure it out.
Yeah, you can get your degree asking us to tell you about financial efficiency here.
Yeah. Wait, but Joe, did you actually went to India for this, or was it more like a virtual? Okay.
No, I'm not going to. I'm not. I don't hop on a plane anymore, man. I don't need to do that.
He's like, hell no, I'm not going to fucking India.
No, I will eventually. Like he keeps bugging me. He's like, when are you coming? Come as my guest. We'll go to all these different sites, and I'd love to. But no, look, I spent 3 months talking to the clinic, and when I ask for, like, it's a big process. When I'm reviewing clinics, it's not just like, oh, pretty pictures, let me make a video. No, it doesn't work like that. I got to know how this operation operates. If that makes sense. Like, I have them send me copies of reports of their inspections. I mean, I do. Like, I actually look into this stuff, and you can tell me that you're doing this or that, but I want to see. Like, he actually had a camera in a surgery to show me how things are set up. So they're not faking it. And when you look at the video I made, you can see their facilities, like it's an actual hospital that they built.
It's totally green screen, dude.
Totally green screen.
No, these guys are top notch. The results are top notch, in my view. And you can see that I have very few. I've accepted very few Indian physicians onto the IHRS, and the reality is, again, not making use of hyperbole. I don't know how many, maybe 5 a week from India, because the industry is growing so quickly. I just lost you, Joe. Have applied to the IHS. I got one today from was it Punjab? Where's that place, Joe?
Punjab.
Yeah. The guy was a plastic surgeon. Says that he's been performing surgery, hair transplant surgery for 5 years. But when you go to check out the website, it's just, in my view, it just looks like a mill, and it's one after the other after the other. If I wanted to fill the IHS with Turkish doctors and Indian doctors and just say, you know what, this is where you go for hair transplant tourism and inexpensive, less expensive places, I could easily do $4 million a year just from the IHS without even blinking. Maybe more. I guess more actually if I look at all my applications.
Probably.
Wow.
So
good for you, man.
Well, dude, that's when you see that it's all Indian and Turkish doctors, you know that I've retired. That option's always on the table for me. If I need to sell out, I will.
Gotcha, man.
I'm just kidding.
Hey, Joe,
I'm just kidding, kind of.
Joe knows what I look like. Joe, do you think my ethnicity could be a factor, or do you think Dr. Cooley can perform how would you say it, like an optimal job on me, regardless of how I look like?
Well, before I answer that question, I'm going to be honest with you. I don't remember what you look like. I've looked at probably, hold on, let me count, 1.2 million fucking photos since you sent me yours. So my apologies. I don't remember what you look like.
Okay, so basically, I have like similar like skin complexion to like I guess Indians. Like I'm Hispanic. I'm from Mexico. I guess you could say. Yeah. So that's
have you tried? First of all, have you tried shaving your head?
Yeah, it doesn't look. The thing is, like, I have a weird shaped head. That's the only thing. Like, especially in the back, and
But how's your face? How do you look front forward? How do you look in the mirror when you shave your head?
I don't look bad. Like I said, the problem is in the back. I have like a weird shaped. What do you call it? A knuckle ridge. Otherwise, I would keep my hair really short if it wasn't for that.
Then here's my response to that. Live that way for a while, before you go under the knife, before you make this commitment. If you say that you can look at yourself in the mirror and feel comfortable, and just you're concerned about the back, which people are looking at you face forward for the most part, think about that. That's all I'm saying. Don't jump into surgery. It's great that you're doing your research, but don't have this in your mind that you have to make this commitment because you think the back of your scalp looks a little fucked up. As long as you look good in the front, it's a hell of a lot better being able to live naturally without having surgery and being a little uncomfortable with one aspect of your scalp as opposed to getting fucked up somehow or having a failure of a surgery. Even in the best hands, that could happen.
Yeah. And
you sound so bummed out, but I just want to give you some really, good advice.
I just found his photos, and I understand why he's really anxious to put some of that newfound bucks from being an accountant to work.
It's because I already had a surgery. Yeah.
Oh, you had a surgery already?
Yeah.
I had like a small teeth.
But there's also what you did for the hairline.
Oh yeah, I had SMP for the hairline and stuff too. I make a lot of mistakes. Let's just say that.
Yeah.
But
so why don't you do, so I'm giving you this. I'm giving you this whole fucking spiel. Why didn't you just say, "Hey, listen, I've already had surgery.
Man,
I already tattooed my fucking head."
Yeah, I mean, I'm trying to get rid of it, but it's gonna take time, and I unfortunately hyperpigment, so I gotta wait even longer than the usual person. But after that, I want to commit to hair transplants. Joe is my inspiration, so I want to follow his path.
No. No, don't follow my path. Okay, my path was not very fun.
This path sucked, man.
But
really?
here's the thing. Here's the thing. Okay, I forgot what I told you about your hairline, with the S&P. Did we talk about laser? Did we talk about anything like that? Okay, all right.
Yeah.
And the laser might actually damage your hair, because Spencer, the issue is that his he had S&P to his hairline, but the S&P is actually just a bit in front of his hairline, and it's really aggressive. The hair, let me tell you, this kid, he looks like Mexican Elvis with his hair. like it's amazing. Like it's 4 feet high on top of his head. I don't know how much of that is a sham, but it looks good. Why does
that make me want to drink?
if he doesn't, I go to the bartender. I'll have a Mexican Elvis, please, on the rocks. But the S&P situation, I get it. I don't know if a hair transplant is going to like this is such a rare situation nowadays. I don't know if a hair transplant is the best idea because of that. So, have you talked to Dr. Cooley about this?
Yeah, I'm going to talk to him now again because I saw your last podcast about exosomes, and I was I was thinking in the future, if I recede more, either go for a hair transplant or if exosomes actually work and are a thing, then I want to put money into that because I do value my hair, and it does give me a lot of confidence in life.
Yeah. Well, I can see why. I mean, you got so much of it, but the hairline, especially in front of your bilateral temporal region and above your temple point, that needs to be addressed somehow. So, Dr. Cooley, he's going to Thailand for a big hair conference. He'll be gone all next week. Talk to him as soon as you can.
What is the main problem there?
I'm sorry?
What is the main problem there that you see?
Well, the darkness above your temple points, like it looks like it's a solid ½ inch in front of your temple point, and it's a very prominent, hard line. And putting hair on top of that, I don't think that's the best idea because the line will still be there. And I mean, hair on top of this, you might wind up thinking to yourself, I should have just taken this out before I had the hair put on top of it.
Yeah, that's what he said, actually. He told me to, try to get all of the ink out, literally. And he said that he will, he'd rather do the job on a clean scalp.
Yeah. Yeah.
But anyways, guys,
look, man,
I think that's all my questions.
Yeah, thank you for the call. I wish you the best of luck. Next time, if I forget your situation, just tell me that you've had surgery.
Yeah.
Just tell him, I had a surgery. Shut up. Stop.
All right, Spencer. Hey, my bad, man. But, guys, seriously, thank you.
Hey, you got it, man.
That's all I gotta say.
Good luck.
Thanks for watching.
Yeah.
888-659-3727. We could take one last call before we end the show.
Yeah, it'll be we're 15 minutes before we hit 2 hours, so
all right,
we'll do it.
Hey, man, you're on the air. Who's this, and where are you calling from?
It's Mo from New Jersey. Save the best for motherfucking last.
Fucking Mo, what's happening, man?
We'll get off the phone. Let's let him call in. Oh,
that's good. I like that.
Mo, how you doing?
Good burn. I'm good, man. Joe, you looking good, man. I like the hair so far. It looks like your final procedure is really really starting to kick in. Now, in when you've had previous procedures with Dr. Wong,
know that.
were you an early
final procedure? You can't see my crown right now. How can you? I mean, I appreciate it, but how can you say my procedure's kicking in? You can't see it.
You just the overall thickness. I mean, I know that. I thought you got a little bit done in the front too. Seriously.
No, it's all in the back.
Did you have the all in the back? Well, yeah, I was going to ask. Did you were you an early kind of sprouter when you first went to Dr. Wong for your first few procedures?
Always. I've always been an early sprouter.
That's what she
because
said.
I'm just saying, because I saw you with a shaved head like about a month ago, and it looks like you don't have a shaved head anymore. That's why I'm fucking saying. Damn, all right, I'll take the compliment back. Spence, always on fleek.
Thank you, man. I appreciate it.
What's going on, man? What's new?
Listen, man, this topic that you guys have about, FUE donor maximum, this hits close to home. For me personally, because, as you guys know, I almost went into the chair, assuming I was going to get a strip. And right in the chair, I'm told that I'm not a good candidate for strip and go FUE. And I actually almost fucking went through it. And I probably would have went through it had I not listened to you guys. In all seriousness. And then last minute, I kind of said no. And the main reason was literally this. I mean, the price, yes, but the main reason was exactly this. It was I didn't want my donor to be, especially for my first surgery, I didn't want my donor to be, I don't want to say destroyed, but even over harvested, if that makes any, if that's the right term I'm using.
Yeah.
Because for the first surgery, I mean, I was always, doing my diligent research that, the best one. And listen, I'm young. I'm under 30, so I know if I go through with this, I'm going to need more procedures, definitely. And I want to try to keep as much as I have, and that hit close to home. But another point that I don't think we nearly talk about as much, and I'll be honest with you, I haven't heard that much here in this show either. Is I know naturalness is number one, and density is always number two in that sense. But don't you think we also have to start addressing, a huge surgery of like, let's say 5,000 grafts for very minimal loss?
Yes.
You mean addressing the fact that these surgeries are being performed on guys who have minimal loss?
But not just these surgeries, but also, Spencer, I was seeing a reputable clinic, a clinic that I really considered during my research. I mean, I still would feel comfortable with them. HRS members, there's a picture of, and it's not just one, surgery. It's one patient who has, he has a recession. He's a little thinned out, but he's not really. It's not like a, aggressive loss. Mostly just in the frontal portion. You would think, if you had to guess, maybe a 2,000 graft surgery. He literally went in for like 5,000 plus, and the result overall is natural, and definitely that's the most important part. But I'm thinking that he's a young guy. He's used up 5,000 grafts for, not a huge area of loss, and overall and I think we don't talk about that as much, and I think it's a discussion we need to have because, and I see it all on these fucking forums, especially the Hair Transplant Network, which just bugs the ever-living shit out of me. Oh, hey, great result, and
the what?
And there's no doubt that the result, the Hair Transplant Network, or Hair Restoration Network.
Now he's going to repeat it 4 fucking times.
Exactly. So
Hair
yeah, good
Transplant
job.
Network.
Please stop.
I'm gonna keep saying it. No, I can't. I can't.
No, the reason for that is, exactly the reason that you just brought up. My concern is always that we want, and that's why Bald True Talk is so moderated. We want patients to be well informed, not misinformed, not guided in the wrong direction by users. And some of these users are actually maybe not even real users. That's the danger of message forums.
And I'll tell you that the idea. Okay, so I know exactly what you're talking about. And when you ask these clinics why are you using so much in such a small area, they'll say, "Oh, well, he's got the donor reserves, and you need those numbers to get real density. We can place it real density." And we knock it out in one shot, one and done. I understand that argument, but realistically, let's say, take for instance, let's be generous and say it's a Norwood 3, okay?
Mm-hmm.
The general rule of thumb has been that for every Norwood level, every solid Norwood level that you need roughly 1,000 grafts to properly address density, coverage, etc.
I don't mean to interrupt, guys. My Instagram feed is ending in about a minute. So if you want to check out the remainder of the show, just go to thebaldtruth.com and check out and go to watch live, and you could watch the rest of the show there. I'll see you guys later. Okay, go ahead.
So yeah, it was about 1,000 grafts for every achieve.
Dude, now your internet's fucked up. Is it your internet or my internet?
No, it's Joe's in there. Looks like it.
Looks like it's Joe's.
I hear you, Spence.
Dude, you're all pixelated and.
Yep, it's moving a little bit.
Oh, now I can hear you. Okay, go ahead.
Now you're good. Now you're good.
All right. So, where was I? Yeah. So, yeah, roughly 1,000 grafts per Norwood level to get acceptable, whatever that means, density and/or coverage. I don't agree with that. I am a believer that more grafts are necessary to get a decent look, but it's also subjective. But at the same time, I think that number is only increases when your Norwood level increases. So if you're a Norwood 3, this would dictate that you need about 3,000 grafts.
Yeah,
more or less true, depending on the hair type, depending on the height of the hairline, depending on the goals. But if you're a Norwood 7, you don't necessarily need 7,000 grafts. You need 10,000 grafts. The question is, can you get it? If you're a Norwood 6,000 grafts isn't going to cut it. It may in some cases, but in many other cases, it's not going to cut it. You'll need 8,000 grafts. So, when you talk to these clinics, they're going to tell you, this guy, he needed more because we wanted to get him as close to native density in one pass. The problem with that is that you can actually have the feeling and appearance of native density with 3,000 grafts. Again, subjective to the situation, but that is the case in a lot of these situations. The other problem with this kind of approach is, what if that 5,000 grafts don't grow?
Yeah.
What happens then?
Right. I mean,
the chances of that happening are extremely low. We have a 98% success rate. Sorry, I don't buy it, because we know, Spencer and I, we know where the bodies are buried. I know where the bodies are buried. I know patients that have had 6,000 grafts and shit grew, and guess what? There's nothing left. They're done. So I'm torn on these bigger sessions. Like, when they work, holy shit, they can be life-changing. But what's wrong with taking it slow? What's wrong with taking that 5,000 graft surgery, maybe doing 2,500?
But Joe, it's all that is true, but it's also, and I get it, the type of hair, and I think ethnicity also plays a role in it, fine, thick hair, whatever. But it's also, I'm seeing, like, for example, I'm actually having surgery in 2 weeks with Dr. Merson and Severin Laura from Paddington Clinic. Now I'm in for about 4,500 grafts, right? So I'm not trying to sound like a hypocrite, but it's my loss is pretty, it's not diffuse loss, but it's a diffuse pattern of loss. You're looking at a Norwood, 5, 6 in terms of the pattern of the loss in itself. But my thing is that that's still a huge area that they have to cover, and I'm seeing literally, people with, let's say, Norwood. I kid you not, a Norwood, let's say, not. I would even say like a Norwood 2 that had over 4,500 grafts in literally one area with not aggressive loss. And it's just like, Jesus, man, you're under 30. You've okay. If you wanted to address the hairline,
I'll go and tell you, I think that they're responsible.
I'm sorry, say that again?
I'll just cut to the chase. It's irresponsible. Less than a Norwood 2 getting 4,500 grafts? Under 30 years of age?
I kid you not. Now, in terms of his age, I'm assuming he's definitely a young guy. He's definitely, if he's over 30, he's probably 32 max. But so I'm kind of estimating his age, but he's definitely a young guy, and it's just, and everyone's kind of just applauding. Hey, great, great result, great this, and there's no doubt that aesthetically the result is nice, but it's, I'm trying to look at the bigger picture here, and I don't think, and that's one thing I did not know of this physician before, but Dr. Sharon, I'm sorry, her last name, Joe, like you that partners with you now?
Yeah.
Sharon. And that was the biggest impressive point was me. Definitely the results, but when I saw, the kind of results she was getting with the number of grafts, that to me was a big, and I'll be honest with you, I just wish I had known of her sooner. But
I
yeah,
heard that a lot.
I
heard that a lot from a lot of people privately and like on the show. Apparently, a lot of people have forgotten about her because she's not been very active online. She's just putting her head down and doing her job, doing her work. And so when I did that video about her, how she was, at the time the newest member of my group, some jaws were hitting the floor. Like, what the fuck? Where the fuck has this lady been? I didn't know she existed. I mean, I didn't fucking know. And I'm somebody who, I've done my fair amount of research, and I haven't really heard of her. And I was just like, exact thing. Where the fuck has she been? But let me ask you something. Sorry to cut you off, but I need to ask you something. This is a burning question I have. So you said when these cases of large graft counts and small low Norwoods are being posted, people are saying, "Wow, looks great! Oh my God, home run," whatever they're saying, and there's no one really asking the tough questions. Who do you think these people are? They're asking. They're making these comments. Like, legitimately, who do you think they are? Do you think that they know what they're talking about, or do you think that they're a mix of maybe, I don't know, maybe not even real people?
Okay, so I definitely think some of these are
I'm not done my question. Maybe they're people that just found the forum and really don't know what they're talking about. They're just, oh wow, that looks great. Yeah, it does, but they don't understand the parameters that go into creating that result. Do you think that if people were more educated and more aware of what they're looking at, that they would actually start to ask the tough questions? Or do you think that if there's a situation where it was 100% legitimate posters asking questions, that someone actually might ask the tough questions?
Well, listen, let me put it this way. In this, it's actually, I don't want to kind of go sidetrack, but, what happened with me previously, with my first, I was supposed to have my first procedure. You guys know all that bullshit. Yeah. And I confided, somebody on that forum messaged me and told me they were actually also going to Hattigan. And, there's very few Hattigan patients in this forum. So we connected, we talked. I told him, hey, I'm going in November, this and that. He also went in. He's actually from Germany, I believe. And, we talked and I told him, my story. And again, this is only in private messaging. And he kind of reiterated this. He basically told my story in public because it matched a very similar story to somebody else who went to the same clinic that I was going to. And except the only difference is he went through with his FUE. He almost the same case. He went in. He was supposed to have 4,500 grafts and strip. Dr. So-and-so said, you may be better for FUE because your scalp is tight. And he actually went through with it. And literally people went after him and said, there's no fucking way that happened in terms of either the other person and me. And now I kind of stay in the back because I didn't want to, I didn't want to deal with all that bullshit. But it's literally people who are like, that can't have happened. And I'm like, yes, it fucking did happen. And I'm telling you it happened. And it's just, I have a more pessimistic view, guys, about shit like that. I actually think they know, some of them. Obviously, the kind of guys there that are just tailing along, they don't. But I think the people because the people that are talking about it, they're, not the moderators, but they're heavily involved. And I do think they know what the fuck they're talking about. And not what the fuck they're talking about.
What?
I think they do know.
What? You're kidding me.
Wait, you think that maybe they might actually be participating in this?
What do you mean? Say that again?
So let me get this straight. You're saying that the moderators of a certain forum are actively trying to sway people in a direction, one direction or another, as far as surgery is concerned.
Oh, listen, Spencer, I kid you fucking not. And again, I don't want to keep going back and forth. But with this particular patient who shared my story, right? A fucking moderator literally went to him. He said he didn't even give the full thing. He didn't go through the shit. He didn't say the shit I really went through in detail. You know, how I went with my family, how you know, I came from a fucking different country, how literally I was in the chair, had my hairline drawn, none of that. All he said was, I've been seeing more with this clinic where people are being more pushed towards FUE rather than FUT when they've been advised on FUT. And the fucking moderator goes, no, I don't buy that. That can't be true.
Yeah. Well,
and
here's the reality of message forums. We have a full-time moderator and a part-time moderator. The full-time moderator, you will see his name, and that's Winston. If you go through the entire site, Winston will not do anything except moderate the forum. His only job, as far as having to communicate with anybody on the forum, is to explain certain things about why certain things were done or moderated. To get involved in any type of user interaction, to protect anybody, to protect a physician, to protect whatever it is not moderating a forum. It is controlling the flow of information. Moderators should not be there to interact with users on any level except why things are being moderated in the forum.
Collusion.
Yeah, that's it.
But not just that. Again, Specs. The shit he went through real recently about his article, which was a great fucking article, and the moderator. You can ask him. I know you guys. I was watching the UK show yesterday, actually, just for a fact. Yeah. You can ask him about it. The moderators. I could tell you that this particular physician, who was, funny enough, was the one who I'm talking about. And I'll just say, I have great respect for his work. I think he's a hell of a physician, and I still would feel comfortable in terms of just his work. But it was actually at many points less of the physician attacking him. It was the moderators not only defending the physician, literally attacking him out of nowhere, but kind of even going forth it once the physician stopped and defending it.
All I can tell you is that this is my view, and this goes with several online resources and the physicians who have supported them over the years. The reason the industry is where it is today is because of the short-sightedness and the financial support of what I consider to be online terrorism. And, sadly, the people who are harmed the most are the patients who are involved in these resources that are being supported. That's how I feel about it. And, I talk about the forum world all the time, and I tell you guys to stay off the fucking forums. There's not a tremendous amount of interaction compared to the forum that you're talking about on Bald Truth Talk. And the reason for that is most people who go to message forums aren't spending a lot of time keeping conversations going and interacting. They are reading. That's the way, in my view, legitimate message forums actually operate. All the forums that I've been on over the years, unless it is a forum that has to do with, something that's very interactive, like cars or something like that, for the most part, especially when it comes to medicine, people are reading, asking questions and reading. That's it.
Right.
So your story is, I'm glad that you're telling it, but it's, what Specs went through during that situation was uncalled for.
It was 100%.
You know?
It really
But
was.
but the way he handled it was first class.
Yeah.
I'm gonna let you guys go. I know it's been a long night for you guys. Thanks again as always. I'm going for surgery in Switzerland, with Dr. with Haddingen Clinic, in November 20th and 21st. It's a 2-day procedure, FUT.
Tell
I'll
the doctor to stop worrying about what's happening on the forums. Do me a favor. Tell him I said that.
This position that I'm going to?
Yeah. This is not it's not about the same situation that we just talked about.
No.
Okay, I'll let him know you said that, Spence.
Yeah, just say, listen, don't worry about the forums. It's not 2001. 2001 is calling. They want their fucking message form back.
It wasn't him. That was a different one. That was the other guy in Switzerland.
Oh, it's the other guy in Switzerland.
Yeah.
Yeah.
Oh, you're going to Haddingen. Okay. All right.
Yeah.
No, it was him.
Going to Haddingen.
No, it wasn't. It was the other guy.
No, they both. I'm not talking about the Frenchman.
No, I know. It's another guy. Trust me.
Okay.
It wasn't. All
right.
Just trust me. It wasn't him.
I trust you. All right. Well, then don't say it.
I don't know if I want to go now. What's going on?
Oh, no. I have nothing to do, dude. You're in good hands.
Yeah.
I appreciate it. And again, guys, thanks as always for the information. I'd be fucking, lost and confused without you guys. In all seriousness, I really mean that. And honestly, I wouldn't have had the balls to say no to surgery the first go around. And I still am shocked that I went that route because it's something I wanted to do. But you guys literally gave me the testosterone and my, and filled this, my testicles with semen to say no. So I appreciate it. And I'm going to talk to you guys soon.
All right, man. Listen, good luck. All right?
No doubt. I'll talk to you guys soon.
All right. Take care. Bye-bye.
Bye, buddy. Bye.
I'm so confused.
I've never had anyone say that we put semen in his balls so he could say no.
Yeah.
I didn't know I had that power.
We're fucking giving people juice, man.
Apparently.
Juicing them up.
Juicing them up.
All right, so we didn't do what we said we were going to do at the beginning of the show. So you're going to have to do it at the end of the show.
I don't remember what the hell it was. I forgot what it was. Oh, yeah, the websites.
Yeah, the websites.
All right. So, I want to throw a big thank you to the other websites that do support our message and allow us to stream through their web properties, starting off with my boys over at hairlossexperiences.com. It's primarily a UK-based or focused, not even focused, just based hair restoration and hair loss forum, clinics sharing the results and patients sharing their experiences, and the owner working diligently behind the scenes to help other repair patients like himself. And I got to tell you, the guy knows his stuff when it comes to the UK hair restoration market, all the pitfalls, all the slime balls, but there's so many. I don't think he knows all of them because it's countless. It's an amazingly harsh market with very few points of light that stand out.
It's one of the worst markets in the world.
It really is. Yeah. That's hairlossexperiences.com. Check them out. Second up, we got bellycapelli.formfree.it. It's the Italian hair loss and hair restoration forum. Clinic sharing results, patients passionately sharing their experiences, and also the owner is another repair patient, a very old friend of mine, also helping people behind the scenes. Great resource that also supports our message. It's bellycapelli.formfree.it. Check them out. And finally, the French Hair Loss and Hair Restoration Forum. Again, clinics sharing results, patients sharing experiences, and they do also share our message and want to get the word out. So they allow us to stream and broadcast on their web property. That is international-hairlossforum.com. Check them out.
The websites, our websites, thebaldtruth.com for archives of this broadcast. We will have the first archive that's been put up in a long time, put up tomorrow. So check that out. And also, you're going to be able to find us on Spotify in the next day or two. And obviously, you can subscribe to us on iTunes. So check that out. That's The Bald Truth, obviously, on iTunes. I want to thank everyone who's been listening on iTunes Radio, iHeartRadio, Stitcher Radio to the live broadcast. Also, Jesus, that's some image there.
Yep.
And let's see, the American Hair Loss Association is AmericanHairLoss.org. Proud to say that the American Hair Loss Association is the most referenced organization in the world of hair loss. In the world. Almost every day, we are referenced by the mainstream media or the blogosphere. And there's a reason for that, people, because all we do is tell the truth. That's it. Nothing to sell, people.
It's not the my truth BS scenario.
Yeah.
It's the truth.
It's the truth. International Alliance of Hair Restoration Surgeons, only hair transplant society ever to be endorsed by Consumer Reports magazine, Consumer's Digest magazine, and of course, WebMD. Again, no other organization in this field, in this space, has ever been legitimately endorsed by anybody. Is that not true?
I started to drift because I was looking at some comments and it's like no one legitimate has ever no one's endorsed these people. It's like we're the only ones to get like any sort of endorsement from anyone
ever in the history of hair transplant surgery.
That's hilarious.
That's reality.
It is. That's the truth.
That is the bald truth. And there's a reason for that. We have created a consumer-centric resource that mainstream medicine and the media really go to for guidance. There's no agenda except making sure that you guys have a safe place to start to do your research. That's the agenda. No matter what these fucking doctors who are not part of it say. That's the reality. Oh, and with that said, I want to make this clear. As with any medical society or organization, consumer organization, all doctors pay dues who are part of what we do. Just like they pay dues to be a part of the ISHRS. That's it. That's the way that it works. And if you're going to other societies' websites and you see someone listed on their website, it's because they paid their dues, money, to be listed on that website. So any website that claims that, well, not anyone, there's one out there that this doctor tried to put up a while ago, but any actual society in this field that claims that doctors do not pay to be listed on their website, I'm not quite sure how they can claim that. When I know if someone stops paying their dues, they're taken off that site. Lickety-split.
I mean, if that were true, it's like, then everyone can stop paying and they'd still be listed.
100%. Which I think these guys should start doing. See how it works.
That'd be a very interesting experiment.
Because if you stop paying me, you're not listed. That's the reality.
The switch is flipped.
We flipped that switch. We want doctors who support truth in advertising, the message that surgery is a last resort, the fact that you are all going to be scrutinized, and you have to appreciate that and deal with the fact that if there are enough complaints, you're no longer part of the organization. Everyone who's signed on to be a part of this and who's been accepted into the International Alliance of Hair Restoration Surgeons accepts that reality. We're not here to sell you surgery. The IHRS does not have online consultation forms. Sorry, people. If you're looking for a lead generator with online consultations, first of all, in the United States, you better check with HIPAA and your attorneys. But that's not what the IHRS is about. So, recognize that a lot of the members who are part of what we do have a certain, not only a certain skill set, but they're people of character that really care about the well-being of patients. I better stop.
I was waiting for it. I was just waiting for it.
I'm not going to say it. Let's see. Joe Tillman's personal website is hairtransplantmentor.com. Anything Joe Tillman, again, that's hairtransplantmentor.com. Check out his story, what he's been through to get to the position that he's in today, the hell that he had to go through for a lot of his life, and why he is the original hair transplant mentor, and why he has a position on this show. Hair Transplant Mentor, youtube.com/Hair Transplant Mentor is where you can find Joe Tillman's YouTube page, where you can watch this broadcast live, where you can find all of Joe Tillman's hair transplant classes and any other videos that he decides to put up. Subscribe. Take the time to subscribe. Take the time to ring the bell so that you can know when we go live and get notified. And take the time to like this fucking show right now if you're listening or watching us on his page. It only helps.
That would be nice. Oh,
you're not going to see anything on the bottom of any links or anything that I'm aware of, unless he's changed his format.
Well, there's no links to products to buy.
Right.
Yeah, there's links to my website.
There's no discount codes or any shit like that. Guys, come on. How fucking stupid are you? Wake the fuck up. This is free information. We're out there to tell you the truth. That's it. Nothing to sell. Hard concept for people to fully grasp.
It is.
Yeah.
It is, because apparently there's a conflict of interest with sitting here for 2 hours talking to people, hearing their problems, talking them through their issues. Yeah, it's interesting. So people listening and watching, that's some more inside baseball.
Yeah.
People behind the scenes are talking about this show as having some sort of financial. I don't know what it is actually, but anyway, yeah, we're just rambling at this point.
Yeah. Well, I can tell you this. Here's the bottom line for anyone who believes that. For some of the German guys that may believe that out there, or the Frenchmen. The reality is not the French foreign owner. The reality is, I can step off this pulpit any day and never look back. That's my reality. I do not need to do this in order to earn an income. That's my reality. I am 54 fucking years old. I've been doing this for a very long time. And more people have read my work than every fucking hair transplant surgeon combined 1,000 times over. And why am I saying that? I'm saying that we do this for nothing because we believe in what we do. And you know what? Frankly, it's because I want to finish what I started 20 years ago. That's it.
It's a good reason.
So until next time, guys, please be safe out there. It is really an insane fucking industry. Stay off the forums if you can. By the way, our forum is baldtruthtalk.com. You can check it out if you want. But the reality is it's a very dangerous place. Trust no one. No one, except for yourself. You can decipher what's real and what's not. All you have to do is really listen. So until next time, be strong, God bless, and thank you guys so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.